All right, a rare bit of good news in the ongoing Ebola crisis. The World Health Organization has declared the Ebola outbreak over in Senegal. But this deadly virus continues to spiral out of control in neighboring Guinea, Sierra Leone, and Liberia. Let's talk now more about the situation with Gavin Macgregor-Skinner. He's an infectious disease expert and a professor at Pennsylvania State University. It's good to have you with us this morning. Let's start first with Senegal, the World Health Organization declaring the outbreak, the crisis, over in Senegal. Senegal closed its border with neighboring Guinea. There are some in this country who say that the U.S. should close its border. It's hard to argue with the result. What do you think?
No, Victor, we should not close the border here in the US. The border with Senegal is contiguous with countries that have active cases of Ebola. It's a very porous, transparent border. There's no actual regulated border crossings. So they made a good decision there. They also increased their surveillance, both at the community level. They incentivize contact tracing by using text messages and actually rewarding people for responsible behavior.
Of course, closing the border here would mean banning flights from those three inflicted countries. And you, I'd assume, would say that banning those flights is a bad idea.
It is, because so many people require just to transport to West Africa right now to fight Ebola, but also back. What are my friends and colleagues in West Africa going to do who are actively fighting Ebola right now, and they get fatigued? This is really mentally intensive, and they need to come back to the US to see their loved ones, their family, and relax before they can go back to West Africa. We all want to go back to West Africa. And I want to just say that I've had contact with many Ebola patients. I never put myself into quarantine, never put my team into quarantine, but I do control the movement of my team for 21 days.
Let's talk about contact, because we've heard from Kentucky Senator Rand Paul. He said this, I'm going to quote him, that if someone has Ebola at a cocktail party, they're contagious and you can catch it from them. We do know that there are some health officials, some researchers, including Lisa Brousseau at the School of Public Health at the University of Illinois in Chicago. They believe that Ebola could spread through the air. And here's a quote. Let's put it up. We believe there is scientific and epidemiologic evidence that Ebola virus has the potential to be transmitted via infectious aerosol particles both near and at a distance from infected patients. Is that possible?
Victor, this is a great question and an important question. We need someone to manage the event, both in the response but also the research. We need to create a platform of transparency and collaboration for research so that we have many experts, many of my colleagues and friends around the world actively working with Ebola every day. As they get those results, they need a platform to present those results so other scientific experts can look at those. And we haven't created that. We haven't incentivized the research. Now, the research we're seeing at the moment is that there has not been the sufficient mutations in this virus for it to become aerosolized over a long distance. In the training that I do at many hospitals throughout the US, we teach the 6 feet rule. If you're not wearing the PPE, take the 6 feet rule. You are in close contact with a patient once you become within 3 feet. And that's something we are teaching in every hospital in the country.
Carnival Cruise Lines, we know that they have this worker who was possibly exposed to the specimens from Thomas Eric Duncan, and now in a self-quarantine on the ship. They've also refused to let any passenger who has a ticket to board one of their ships. But if they've been from Guinea, Liberia, or Sierra Leone in the last 21 days, they will not be allowed on board. Do you expect we'll see more of these de facto bans from independent companies?
Not if I get your help, Victor. I need the help of every journalist in this country. We have seen so much irrational behavior when it comes to Ebola. Let's stick with the facts. And the facts have to be reiterated all the time. Direct contact with all those bodily fluids that we've talked about. Then you have to put your hands or whatever part of the body fluids in your eye, your nose, or your mouth. It doesn't get absorbed through your skin. Patients, people cannot spread Ebola unless they are showing the symptoms of fever, vomiting, and diarrhea. If we can get that message out every hour of the day, and I need every journalist to help me on this, then we can decrease the fear, we can prepare the hospitals here in the US, and we can alleviate all the worries and concerns that the US public have.
All right, Gavin Macgregor-Skinner with Pennsylvania State University. Thank you so much.
You're welcome, Victor.